I love the analogy of the iPhone. To think about all the things that it can do today, it feels like AI is kind of the same way. We know it's going to be incredible. We know that it's going to be insanely impactful. We know we're going to overstep a little bit, but it's almost like there's this great unknown out there.
The beauty of the artificial intelligence that we're seeing now is that it's just like healthcare. At the end of the day, we're all consumers. None of us sort of saw that the iPhone would be doing so many different use cases and so important to everything that we do. I think AI is going to be pretty similar. It's an evolving area. It's almost like the early years of the iPhone. You see 4 or 5 core use cases now that have really become front and center. This movement, ambient listening, revenue cycle, administrative functions, operating management. I think very few people can predict exactly where it's going to take things over. And, you just hope it doesn't become like RoboCop by the time we figure it out.
Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civitaris, and today I'm thrilled to be joined by Scott Becker, distinguished entrepreneur, investor, and legal professional who's built a remarkable career at the intersection of healthcare, media, and law. As the founder and publisher of Beckers Healthcare, a leading healthcare media company, and a longtime partner at McGuire Woods, a top AmLaw firm, Scott has established himself as an authority in this field. With a mission of providing valuable insights and strategies for entrepreneurs and business leaders, Scott draws upon his extensive experience to help others navigate the complexities of building and scaling successful ventures. His expertise spans across various industries, including healthcare, private equity, and venture capital. He hosts 2 highly ranked podcasts, Beckers Healthcare Podcast and Becker Private Equity and Business Podcast, where he shares his knowledge. He's interviewed prominent figures such as George and Laura Bush, Bill and Hillary Clinton, Nikki Haley, and New York Giant great Michael Strahan via Beckers Healthcare conferences. Scott is also a prolific author, having written several books, including his newest, Building Great Businesses. Welcome, Scott. It is great to have you on the show.
Well, Chris, thank you so much. I'm so thrilled to be here. And what a remarkable history the Taylor companies have. So fascinating. And thank you so much for having me on. I'm looking forward to visiting with you.
Yeah, I'm thrilled to have you here. I'm a big fan, obviously, of Beckers, and I started my career 20 years ago, right out of college in the industry. So I can't thank you enough for all the information that you've brought to bear, first in kind of the written publications, and now also including the podcast. You've been a huge influence actually on my career, so I thank you very much. And to kick it off, I'm hoping you can share a little bit about your background and a little bit about the work that you do for those of our listeners that might not be familiar.
Sure. So again, Scott Becker, I have straddled 2 careers forever. One led to the other one. I was originally a lawyer, for better or for worse, but a lawyer in the healthcare field. So going back about 35 years ago now, I started to build a very small newsletter, a very small event in a sector in healthcare. And it was really aimed at not being a media company. It was really aimed at sort of what you would call today thought leadership. Back then, they didn't really have a term for it, but was trying to build a reputation as someone who knew healthcare sort of law and business. And that was sort of the gist of it. After several years of doing that and building a law practice, I ended up really turning my efforts towards turning that very small newsletter and that small conference into a more serious effort in the healthcare world, into a media effort. Started to hire great people. We talk always about everything's about building great teams. Started to hire great people. One of those leaders became the CEO of the company, Jessica Cole. One of them became editor-in-chief, Molly Gamble, and ultimately built a healthcare media company around really, it's so funny you say print newsletter, because we really had to pivot from print because our competitor in print could afford to send out 60,000 issues a week, and we couldn't do it. So we ended up really going back 20, 25 years, trying to be what's called today digital first and event first, really focused around digital newsletters, websites, webinars, and then, of course, around meetings and events. And so we have these huge conferences. We've got our largest conference of the year coming up in a few weeks in Chicago, and it's been, and we try and be short form information, teach and entertain about people's sectors in healthcare, and make it easier for people to get their hands around, what's going on. And we try not to be, when I started this, I wrote deep, long research papers. Nobody would read them. We moved 20 years later to what we call short form journalism to give people a sense. Here's what's going on. Here's the core what's happening. And that's really what we do. And we've enjoyed it tremendously. We've got a fantastic leadership team, a fantastic group that really runs things day to day. And I still serve as chief content officer, but Jess and Molly and a lot of other people really run the company day to day and have just done a fantastic job rolling it out. And our job is to stay very close to our audiences, whether hospitals and health systems, health IT, some of the physician areas, and so forth. And so we spend a lot of time, and we spend a lot of time in the digital health area. One of our conferences is Health IT, Revenue Cycle, and Digital Health, which is one of our fall conferences, and try and be conveners around core issues that are important to people.
And I'm so excited to talk with you about where technology is going, especially AI, because you have this really unique vantage point that gives you a window into healthcare operators and investors. So from your perspective, where is AI actually delivering today? Where is it delivering value? Where is it delivering an ROI? And where might there still be kind of more hype than help, if you will?
Yeah, no, I think that's a great question. I mean, you see AI is sort of what we think of it as cascading use cases, cascading places where it has value and adds value. So if you look at sort of how the iPhone developed, back when the iPhone really started, the predecessor was the BlackBerry. None of us sort of saw that the iPhone would be doing so many different use cases and so important to everything that we do. I think AI is going to be pretty similar. I mean, but it's an evolving area. It's almost like the early years of the iPhone. What you see in AI is you see 4 or 5 core use cases now that have really become front and center. You've got things like ambient listening. There's a race to get ambient listening into so many ORs, so many procedures, so many doctors' offices because it's just taking load off of physicians. You've got companies like a bridge and ambience that are just way out in front. And you hear, you know, pretty soon moving to a spot where larger systems can't live without it because it takes such an amount of stress and documentation time off of physicians. You see artificial intelligence, one of the earlier use cases, a company called Acasa was very deep into AI with revenue cycle. And it ended up taking out a lot of sort of the constant, I wouldn't say menial tasks that were very hard to staff for, very hard to take care of, and triaging revenue cycle to where you had to have, instead of 2,000 people, you got 1,200 people, but focused on the harder claims, the more valuable claims, the more valuable things. And those just, ballpark generalist numbers, but taking out a lot of work that was almost impossible to fill. That was almost impossible to get done, almost impossible to staff for. Then you see sort of evolving use cases around predictive analytics. More and more people are using AI. I was just on a podcast with another company called Lean Toss, where they essentially use AI to help manage operating rooms and so forth, and infusion centers. So you see like this movement, ambient listening. You see it around revenue cycle. You see it around increasing amount of administrative functions. You see it around operating room management. The next big frontier is there are two big next frontiers. One is enterprise solutions throughout health systems. So you've got systems like Cedars-Sinai that right now went through a process recently of training 6,000 or 8,000 of their people around AI solutions and trying to move things from one-off, you or I do something with ChatGPT, towards where the system uses AI more wholly or more holistically. So that's one spot. The second place is the evolution of artificial intelligence towards the clinical direction. Towards we've got this tremendous shortage of primary care physicians in our country. We've got incredible shortages of specialists in our country. How do you start to make a dent in that through artificial intelligence or supplementing what they're doing? And so that's sort of the next big frontier is, yes, a lot more enterprise solutions throughout systems, but then clinical solutions. And we're sort of evolving on the clinical solutions and where they could actually take some of the load off of physicians and specialists. But we face dire shortages of physicians and specialists. So trying to figure out where this all fits in. So that's sort of the next evolution. And I don't think you could follow the cascading of it, but much like the iPhone, I certainly can't. I think very few people can predict exactly where it's going to take things over And we think of things that are 2x solutions versus 10x solutions. A 2x solution gives people back some of their time. A 10x solution takes over the job.
Right.
And the difference between where we'll have 2x versus 10x solutions, I think is evolving, and we'll see where it goes.
Yeah, absolutely. I want to stay on that thread a little bit in terms of that 2x versus 10x, because one of the other things that I think there maybe still is, I don't know if confusion's the right word, but maybe the lines are still a little bit blurred in terms of real AI transformation versus what I'll call automation. I mean, are there litmus tests that healthcare leaders should be using to evaluate those types of things that will actually be transformative in their space?
Yeah, I think it's a great question. And of course, I'm by nature not a technologist. It's not, so what happens is what the beauty of the artificial intelligence that we're seeing now is that it's just like healthcare. Every single one of us is a consumer of healthcare. So people could tell you there's not access problems, there are access problems. But at the end of the day, we're all consumers. So we see what we see. And when somebody has a bad diagnosis, we see how hard it is to get the right person. I think on whether it's automation versus is it artificial intelligence and the blurring of the lines, I think that's a great, great question. And I think, everybody that's got an automatic solution or automated solution now, of course, says it's an AI solution. And I don't know what the exact definition is to give you a great answer on that. I don't know. What I do see is because like all being consumers in healthcare, we are all touching artificial intelligence in different ways. Just like in different, whether it's one-off stuff, like, okay, I've got to get 7 questions out for a podcast. So instead of me writing them by hand, I know go to Chat GPT and it does it for me as well as I could do it. Maybe I'll add a little color to it, a little bit to it, but it does it really quickly versus enterprise solution. Oh, I've got to plan a whole year's worth of stuff. And could I do it for the enterprise or strategy through an AI solution versus an automated solution? I think it's a great question. I mean, we've seen in the labor crisis, the labor situation, we've seen companies go from, and again, these are complicated topics and they hit different people politically in different ways, but we've seen people go from, hiring everybody in the US to outsourcing a lot of stuff to other countries and seeing dramatic reductions in cost when you do so, but requiring another level of management. Because if you're going to outsource a lot of stuff to another country, you've got to make sure you're managing it well and getting the results that you want. So the next stage is, can some of that stuff go from labor in the US to labor overseas to automated, or AI, whether it's automated or AI. And that's the transition you see going on. And that's on one hand, it could be really positive for bottom lines. On the other hand, it's quite scary because a lot of people are employed through all these
Right.
different things that were done. So with all these things, there's just huge societal positives and societal challenges. And so trying to figure those things out. But when you ask the question about automated versus AI, when first people started talking about large language learning models or different types of concepts, machine learning, et cetera, to a non-technologist, it all sounds a little bit the same, but what you see is, okay, what does it do? Where
Right.
are we at? What's the results? What's the use cases? And I don't have a good answer for how you differentiate. Are we really using the system artificial intelligence, or are we just automating attacks? I think people would say like the artificial intelligence means it's taking a step further in thought, it's taking a step further down the road, and it's helping solve to a different level than you just telling it what to automate.
With the leaders that you're working with across healthcare and the businesses that you've been exposed to and work with as an investor, your experience in private equity, venture capital, again, you have this really broad swath of knowledge. Do you see, I mean, are companies out there leading with the problem and trying to fit the technology to solve the problem? Or do you still think that we're kind of in a phase where we've got this brand new technology and we're trying to find the ways to kind of apply it as the technology develops? It's kind of like what's pulling what? Are the problems pulling the
Yeah.
technology, or is the technology leading to what problems we can solve, I guess?
Yeah, it's a great, great question. It's a great question, and you see different companies coming at this with different intentionality.
Hmm.
So I was on the phone last week with founders that have really, really bright people, and I would say they're closer to what you're talking about, the approach that often we think of as flawed where people have a technology and they're trying to figure out the problem for it. You follow me? And the
Absolutely.
flip side being, some companies really evolved very clearly around a problem. So if you look at,
Right.
and again, I don't want to spend a lot of time mentioning sponsors' names that we work with and stuff like that. So I'll try to avoid that. But one of the companies, there's been this tremendous challenge with operating room management, operating room efficiency, or infusion therapy efficiency. People had lots of empty spaces, a lot of unused spaces. At the same time, they can't get cases scheduled. So there's companies that develop technologies around operating room management that's been really helpful. Really solving a problem. There's been people that develop solutions around ambient listening, because at the end of the day, a problem grew out of the EMRs that all of a sudden, like, you always had the problem of doctors, whether you had electric medical records or not, having to do lots of documentation later in the day, or whenever they were doing it, and getting away from them being able to actually talk and visit with patients and just exhausting people. So people have come up with this ambient listening, which has become, it's the hottest thing right now for the last
Right.
couple of years, where there's a race to get into the systems, because they're actually solving a real problem. Is doctors, they call it pajama time. It's been an overused phrase, but people spending a lot of time at night
Yep.
going through records. And so this is intended to really cut down on a lot of that. So those are people that have solved specific problems. And then you do see, it's like a gold rush with AI. And whenever you have this gold rush type thing, and there's winners, there's losers, but you do see, people that are developing technology and trying to find a problem for it. Often that doesn't work out very well. Sometimes it does. And then you have people really solving problems. And all these technology companies have multiple different problems, challenges they're trying to work through, which is they're trying to find a market. They got to have something they're really good at, so that people just don't default to Epic. And at the same
Right.
time, they got to be good at it and so good at their point solution. But at the end of the day, investors don't just want a point solution, and hospitals don't just want a point solution. They want things that go much broader than point solutions, so that a hospital system doesn't have to work with 3,000 vendors. They want to work with
Right.
a limited number of vendors, a limited number of partners. So I think it's a great question whether people are building technology to, we've had lawyers over the years that are so bright, but they don't connect what they're doing for the client. And at the
Right.
end of the day, if you're a great lawyer that doesn't connect it for the client, you're almost useless, no matter how bright you are. And so your point on technology, the best companies are really closely tied to their customers and almost like partners, and they really are working to solve problems versus just developing technology because they're bright and want to develop technology.
Yeah, and it sounds like there might be some tension there in terms of you've got all of these companies that are doing these wonderful things, often at the point level solution, as you say, and you've got health systems that said, I've spent whatever I've spent on Epic, and I've chosen kind of my core, set of vendors, and they spent a lot of time trying to consolidate over the last few years everything that they could to an Epic or an Oracle or a Meditech or kind of insert EHR company here. So am I right? Does that sound like there's a little bit of a tension there? And then if there is, like, how are health system executives thinking about those two sort of elements? And then also you inject the traditional build versus buy. Put me in the mind of a CEO? What are they going through in terms of that tension in those decisions?
Yeah, and I think that's a great question. And you could look at the mind of the CEO versus someone who runs a specific service line. So
Hmm.
the CEO very much, or the CIO, chief technology officer, very much wants to move things towards an Epic first mentality. And what's happened with Epic over the years, as an example, and Epic just one example, but Epic over the years, back in the day, they developed the enterprise-wide EHR, and they'd have tons of different modules. And over time, the different modules would be great or good or bad, and different point solutions could pick up business in areas where Epic wasn't so good in those areas. What Epic's done over the years, they've become a much more consistent builder. So they put out often in a module what you almost think of as a minimum viable product, but then they do an incredible job. I mean, Judy Falk and their team have done an incredible job of building a systematic improving company. So what happens is they develop their modules. They will go from very immature to very good over the course of several years. And there'll be lots of opportunities at the CEO level, CTO, CIO level, generally you want to be one huge enterprise first and not be using 1,000 different app solutions or module solutions. And at the same time, if you're a point solution, a senior leader in a service line might look at Epic and say, well, it's great for that, but it's really useless for me in what I'm trying to do on OR management in my orthopedic group. So I really want the point solution there, or a large point solution there, versus the all-in Epic solution. And so you have this constant challenge. But what it does is it raises the stake for a company, and that you really have to have something that's useful, that has cost benefit, that people could say, like, oh yeah, this makes a difference for us. I don't want to just default to the mainframe program, to the larger enterprise program. It's a constant tension. And there's a constant tension amongst point solution companies that they have to be, it's like anything else. We always say in business, if I'm working for people, I don't want to work for 30 different people. I work for three and be very, very important to them. And,
Right.
and so if you're a solution, ultimately you want to be great at what you do, but you want to be really needed by the system. And that often means growing into other areas and more solutions. And that can cause challenges because sometimes you're so great at your point solution, but you're not particularly great at the other things. So you have this constant tension on every side of this equation. I think it's a great question, Chris.
Yeah, let's stay in the boardroom for the next one. With all of this, obviously, comes risk, and I think about that from a data integrity, a bias perspective, regulatory exposure. What are you seeing there? And certainly, obviously, with your background and your acumen with the law, are we making enough progress without letting fear stall ourselves? And what are you observing at that board level as you think about risk, and particularly around AI and all that's coming?
Yeah, no, I think we are making a ton of progress. I mean, I think it's you have this very complex balance uh, between those that want to drive forward with all kinds of solutions very aggressively and be sort of a really technologically advanced system versus those that are constantly trying to remind people and please people on the different risks and the challenges and issues. And I think you see this throughout society. You see sort of like the push forward in the autonomous vehicles versus the potential accidents that come from them. Notwithstanding the fact that we have so many accidents, anyways, but trying to figure out the right balance on it. And then you've got vested interest in everything as well. So, but I think from the board perspective, people are very much people are very afraid at system levels. It's not that people want to be a first mover, but they also don't want to be left behind as a system either. And so you see, I don't think we're being over. I mean, you can have different problems, which I'll talk about in a second. But I think at the end of the day, things are moving forward pretty fast, and there's only so much that people can deal with in terms of change management, anyways. But I
Right.
don't think generally the I'll give you a separate example in a second, but I think generally the people that are trying to remind systems to be careful are getting their airtime. Systems are trying to be careful, but they're also trying to move forward aggressively. Because they don't want to be left behind in this artificial intelligence race. Now, the flip side is you have some states, and almost always this becomes. I mean, you could look at this in two ways. I view it as very protectionist legislation. You have states that are trying to say you can't use AI to ask a health question. You can't use AI to do legal work. You can't use, I mean, New York recently has a bill going along those lines. Well, you're in New Jersey, so I'm probably work in New York some too. But New York
Absolutely.
recently had some potential legislation around, policing the use of AI. And again, on every level, you could say, well, there's a good reason for that because we don't want AI doing things wrong. On the flip side is often that legislation comes from a protectionist standpoint of doctors, lawyers, others not wanting to take away their jobs. And I get that. It's almost like the big fight last year between the Screen Actors Guild and Hollywood, evolved a lot over, could AI replace actors and actresses? Could AI do what could they do and that ended up being one of the biggest things in the Screen Actors Guild strike last year. And those are, and again, I don't mean to downplay that. It's very real human emotions. Is this going to take my job? And so, but I do think you have this fine balance of regulatory versus not. But if just like with the tax stuff, if one state overregulates it, they're going to end up losing opportunity to other states. And similarly, just like if one state overtaxes its citizens, sooner or later, some of those citizens' business move elsewhere. And so I think you're in a really tough spot as a state to overregulate it without being left behind. Because it's a very national, international world. And I think the same thing with a lot of this. I just don't. I see it at the boardroom, but I do see, and again, you have a gauntlet in the boardroom that's really pushing forward aggressively, and then you've got a piece of the boardroom that's saying we got to be careful. And they're both are having their say, and I think we're working through this in a pretty rational way.
I think that this is a classic example of you have to lead through dialogue, and I don't know that there's another way to do it because we're kind of inventing not just the technology, but the governance and the processes and kind of everything around the technology as we go. So, from my perspective, at least, and what some other guests on the show have kind of exposed is, as long as we're all talking about it, as long as we have the right stakeholders at the table, that maybe is the path forward.
Well, that's right. And I think what happens is there's this need for guardrails, but make sure those guardrails are not so challenging that people just end up working around them. And so you see that as well. So I think it's an evolving discussion, and it's a lot of this is evolving to where, just like when I talk about the iPhone, in a million years, we wouldn't have known all the different directions it would take. As you start to see different directions with this, then you'll probably end up with, as consequences, some different legislations and different rules on it, as you see, like, okay, that got messed up. That ended up being a problem, and you just hope it doesn't become like RoboCop by the time we figure it out. But we'll see.
I love the analogy of the iPhone because you can think about all the, like, if you were holding that iPhone in 2000, whatever, to think about all the things that it can do today, there's no way that the average person could have sat there when it came out and forecasted that it could do everything that it is doing. It feels like AI is kind of the same way, that we know it's going to be incredible. We know that it's going to be insanely impactful. We know we're going to overstep a little bit, but it's almost like there's this great unknown out there in terms of the things that AI will be doing for us in the next 3 to 5 years. Is that fair?
I think that's exactly right. And you look at the 3 to 5 years, even more so, even longer out than that, as to where it will have impact, what it's going to mean. But I think that's exactly right. And I think, you could see what's happening now in different spaces where there's clear use cases, it's clearly being used, it's clearly having big benefits. And then there's places where it's unclear, and it's to predict that it's going to or not going to totally impact some of those areas, I think is very hard to do, and to predict how it will do so. So I think it'll be an evolve. We always talk about it as cascading use cases, evolving use cases, and we'll see.
I mean, it's obviously we're going to see cost reduction, workflow productivity, clinical outcomes, all things that you've touched on so far. Do you think that there is, like a great new bastion of healthcare, potentially an entirely new care model? I mean, how far can this thing go in the next 5 years, 10 years? Is it really limitless?
Yeah, I don't think it's limitless, but I think it has the ability to have huge impact. I mean, we are so short doctors and specialists in our country that certain models of providing care are likely sort of going to change dramatically. For example, I grew up with my own primary care physician. You still may be at that age where you had your own primary care physician forever. That is moving towards being a thing of the past, because even now with primary care, when my primary care doctor retires, finding another one without paying concierge is very difficult.
Right.
But we were talking about different ways that things work. Sort of, for example, now if you want to get, obviously the Hims and Hers of the world, the Rose Sparks of the world, the people that telehealth do GLP-1 medicines, other medicines, so forth, and they have, I don't know if you call it artificial intelligence, but they've taken a huge amount of strain off the healthcare system by having consumer direct solutions that don't tie up every primary care doctor's office. Where at one point, if everybody wanted a GLP-1 today and everybody had to go to the primary care doctor, we would be just overwhelmed. It would crash the system, And so what I see is there's going to be all these evolutions where in the ideal world, the AR situation, the revenue cycle situation is a great example. By improving the automation of the regular stuff, the things that are regular things, you've allowed your most important people to focus on most important claims and most important challenges, which has been a huge plus. And revenue cycle is still just a complete mess, but it's a huge part of the system in the country. But it has helped a great deal to sort of focus your resources around what's really needed and where there's harder challenges and harder problems. And I think with physicians and specialists in primary care, I'm a believer that the hope is that AI will take away AI coupled with advanced practitioners, nurse practitioners. We're doing a tremendous job in our country of producing nurses again at a great rate where we were really struggling a few years ago. The combination of nurses, advanced practitioners, and AI will take some burden off of our physician population, and but we still are going to need to reallocate to have enough specialists to take care of things that are the more complex, challenging problems. They'll be helped by AI for sure. But if you look at our country today, primary care is quickly moving towards a PA first model or an urgent care first model or a nurse practitioner model. Oncology is overwhelmed. Oncology and heart disease are still the two biggest killers in our country. From an oncology perspective, every oncologist is overwhelmed. When you get into subspecialties and narrow specialties, the bench in our country of oncologists and specialties and subspecialties is really, really small. It's really, really light. If you look at brain surgery, the bench for true brain surgeons versus spine surgeons, we have a really lean bench in our country, and it's getting a lot worse. So, how do you allocate more residency slots, more specialists to a lot of that stuff? And I think the biggest way to do so would be to moving more of specialties where we could do more of it through AI, we could do more of it through nurses and PAs there, so we could allocate more, more residency spots, more training to the most challenging places. So it's that almost that triage type thing that we talk about in a revenue cycle, but at the physician level, that I think is where we're going to have to go. I mean, we're already a spot where we're 200,000 short primary care. If we want to truly everybody have the primary care physician like we did growing up, like the Marcus Welby model, but those days are pretty much gone, I think. And so why not accept it and say we're going to have primary care, we're going to have internal medicine, we're going to have these specialists, but we're going to have we have to double and triple down on specialists that we're training to go with the AI. And there's so many examples of where we're just so short in terms of true specialists and trying to figure that out. But the ideal situation is AI would cover more and more things that could be done with AI and the combination of PAs, and that would leave us to allocate more and more of our physician workforce to really complicated, really challenging situations.
Scott, this has been a fantastic conversation. I've really enjoyed our time here. I know we're coming to an end, but I really want to dive into your newest book, Building Great Businesses. Can you talk to us a little bit about what to expect, some of the themes you might be addressing in the book, and a little bit more about how it came to be?
Sure. No, thank you so much for asking, Chris. So we talk about in the book and everything we do, we talk about 3 or 4 cores about building businesses. We always start with, are you focused on a niche? Have you built a great team? Are you taking care of your customers great? And to go back to your point on technology, finding a solution or being a solution, do you have product market fit? So we always talk about those things. And we talk a lot about teams. We talk a lot about our one-off thoughts on business, about what I've seen work, not work. So we do a lot of that. We talk about the evolution of a founder, from someone who does everything to building great teams where they have really bright, talented people doing everything, and the business can then accelerate. Talk about 2x versus 10x. When a founder first hires people, they go to 2x. When they hire people that are much brighter than them and much more able than them, then they can go to 10x and grow something a much different size. But we talk about the 5 phases of a business, from idea, to product, to revenue, to profits, to scale. We talk about a lot of those things, and we try and inject into it stories and work and things that have worked and not worked. I've had the beauty of being involved in several different businesses, seeing some be successes, some be clear failures, or somewhere in between, and try and learn a lot from those things. And so it helps me to keep thinking about things, and we hope our readers enjoy it. They learn something, they're entertained by it. We're a big believer that I don't teach somebody something. We give them a framework where they then can continue to learn, or hopefully be a little bit more motivated, a little bit more excited. So that's really the concept. And yeah, no, we appreciate you so much asking the question. I'm going to beg you to buy a few copies, Chris, and we'll go from there. But a different story. But no, it's going great. We've got, I think, 8,000 or so books pre-sold. We're trying to get a lot more pre-sold, trying to make progress. But it's been it's a labor of love. It really is. It's like it allows me. It's fascinating too, because you write the book for one purpose, which is get your thoughts in one place on something. And it's led to just an absolute ton of interesting conversations with people that I otherwise wouldn't get to visit with. So it's, there's always different benefits that you don't expect. And it's been great fun.
I can't wait to pick it up. I can't wait to read it. We absolutely will be checking it out here on my team, across my leadership group as well. Very excited for it. And we'll make sure we're going to link it in our show notes, so that people who are interested can go right to the link in the show notes, pick it up, grab a copy. And as you say, Scott, I love the way that you write and tell stories and provide frameworks for us and for others to use. It's certainly the way that I like to learn and like to apply things, and I'm sure a lot of people would agree with it. So Scott, I know again we're about out of time. I just want to say again, thank you so much for coming on. It was such a pleasure to talk to you, such a pleasure to have you on, and I hope that one day you'll come back and talk to us again.
Chris, and vice versa. What a pleasure to visit with you, and thank you so much for taking the time. And congratulations, everything that the Taylor companies have done. Really remarkable history, and what the entrepreneurs behind Taylor companies have done. They had to be writing the book themselves, but just fantastic. Thank you so much.
Absolutely. And thank you also to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little bit more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.
Informed consent is vital to patient care, but how can you help patients make informed decisions? Introducing iMed Health from Taylor Healthcare. Digital tools that standardize and simplify the informed consent process. Go to imedhealth.com to learn more. Find the link in the show notes.